Mayor Gordon also says the plan to waive fees and suspend codes for a 3-week period could be extended if needed. A new study suggests COVID-19 cases could have been 35 times higher in the U.S. if not for social distancing measures. LEX 18's Sophia Millar is talking to University of Kentucky researchers about their findings.
Does social distancing work to slow the spread of COVID-19? Aaron Yelowitz and his colleagues are answering that question.
What we find is that these social distancing measures dramatically bent the curve on the disease. Why they did might be more speculative, but the fact that they did is essentially a done deal.
The new study looks at COVID-19 cases in 3,000 counties and how social distancing measures influence those numbers.
What our study illustrates is these measures were highly effective. And in fact, perhaps so effective that people actually don't think that COVID-19 is nearly as big of a deal as it actually is.
Yelowitz says without social distancing, the United States may have been dealing with 35 million coronavirus cases on April 28th instead of 1 million. To put things in perspective,
Kentucky, its stay-at-home order and other measures averted about 40,000 additional cases that would have otherwise existed.
Which means
we concluded that about 2,000 lives were saved in Kentucky due to those sorts of measures.
Yelowitz says some measures are more effective than others. For example, stay-in-place orders and the closing of restaurants and gyms substantially slowed the spread of disease, whereas banning large gatherings and closing public schools had less of an impact on the numbers. In Lexington, Sophia Millar, LEX 18 News.